As you have learned in this unit so far, many psychological disorders are characterized primarily by impairments in emotion. Those impairments can influence thinking. For example, people with depression can have distorted thoughts about themselves or their futures. By contrast, some disorders are characterized primarily by extreme thought disturbances. The DSM-5 category of schizophrenia spectrum and other related disorders includes a number of such conditions. In all of them, a break from reality causes a person to have difficulty distinguishing real thoughts from imagined ones, and the person has extreme difficulty functioning in everyday life. The term schizophrenia literally means the splitting of the mind. The psychological disorder schizophrenia is characterized by extreme alterations in thought, in perceptions, and/or in consciousness. These disturbances result in a break from reality, so the person experiences psychosis, the inability to tell what is real from what is imagined. According to current estimates, around 1 in 200 persons around the globe have schizophrenia. The rates for men and women are similar. For the person and for the family, schizophrenia may be the most devastating psychological disorder. It is characterized by a combination of motor, cognitive, behavioral, and perceptual abnormalities. These abnormalities result in impaired social, personal, or occupational functioning, or in some combination of these impairments. According to the DSM-5, to be diagnosed with schizophrenia, a person has to have shown continuous signs of disturbances for at least 6 months. And there are 5 major DSM symptoms for schizophrenia. 1. Delusions. 2. Hallucinations. 3. Disorganized speech. 4. Disorganized behavior. And 5. Negative symptoms. A diagnosis of schizophrenia requires a person to show 2 or more of these symptoms. At least one of these has to be from among the first 3 symptoms listed above: delusions, hallucinations, and disorganized speech. By tradition, researchers tend to group these 5 sets of symptoms into 2 categories. Positive symptoms are excesses. They are positive not in the sense of being good or desirable, but in the sense of adding abnormal behaviors. As you'll see, negative symptoms are deficits in functioning, such as apathy, lack of emotion, slowed speech, and slowed movement. Delusions are positive symptoms most commonly associated with schizophrenia. Delusions are a psychotic symptom because they are false beliefs that reflect breaks from reality. People with bipolar disorder who have severe episodes of mania may also experience delusions. There are 6 common types of delusions experienced by people with schizophrenia. Persecution, the belief that others are persecuting, spying on, or trying to harm you. Referential, beliefs that objects, events, or other people have particular significance to you, such as the belief that a stop sign has a particular personal message for you. Grandiose, the belief that you have a great power, knowledge, or talent. Identity, belief that you are someone else, such as Jesus Christ or the President of the United States. Guilt, a belief that you have committed a terrible sin. Or control, belief that your thoughts and behaviors are being controlled by external forces. Delusional people persist in their beliefs despite clear evidence to the contrary because their cognitive processes misinform them about what's real and what's not. For example, in his 50s, the early 20th century artist Louis Wayne began to experience delusions of persecution and to have difficulty separating reality from fantasy. Wayne was subsequently diagnosed with schizophrenia. Many people believe that changes in his art over time reflect periods where he was experiencing milder or more severe symptoms. Delusions are characteristic of schizophrenia in all cultures, but the types of delusions can be influenced by cultural factors. For instance, Tadayama and colleagues found that German and Japanese patients with schizophrenia had similar rates of grandiose delusions, believing themselves much more powerful and important than they really were. The 2 groups differed significantly, however, for other types of delusions. The German patients had delusions that involved guilt and sin, particularly as these concepts related to religion. But by contrast, the Japanese patients showed beliefs that they were being slandered by others. Hallucinations are another positive symptom commonly associated with schizophrenia. Hallucinations are perceptual disturbances that are experienced without an external source, so they are another psychotic symptom. While they are frequently auditory, they can also be visual, olfactory, or bodily. Auditory hallucinations are often accusatory voices. They may accuse a person of being evil or stupid, or they may command the person to do dangerous things. Sometimes the person hears a racket of sounds with voices intermingled. As with delusions, people with bipolar disorder may experience this form of psychosis during manic episodes. The cause of hallucinations is unclear. According to neuroimaging studies, auditory hallucinations may be associated with increased activity in brain areas that are usually engaged when people hear external sounds or engage in inner speech. This finding has led to speculation that auditory hallucinations might be caused by a difficulty in distinguishing the inner speech of talking to oneself inside the person's mind from external sounds. To function in society, people with schizophrenia have to learn to ignore the voices in their heads, but doing so is extremely difficult and sometimes impossible. Another key positive symptom of schizophrenia is disorganized speech. The speech is disorganized in the sense that it is incoherent, failing to follow a normal conversational structure. It's very difficult or impossible to follow what people with schizophrenia are talking about because they frequently change topics, which is known as a loosening of associations. More extreme cases involve clang associations, the stringing together of words that rhyme but have no other apparent link. People with schizophrenia may also display strange or inappropriate emotions while talking, such as strange speaking patterns make it very difficult for people with schizophrenia to communicate. A final common positive symptom of schizophrenia is disorganized behavior. In other words, people with schizophrenia often act strangely. They might wear multiple layers of clothing, even on hot summer days, walk along muttering to themselves, alternate between anger and laughter, or pace and wring their hands as if extremely worried. They have problems performing many activities, which interferes with daily living. About 1 in 4 people with schizophrenia show reductions in typical behavior, which are called negative symptoms. For example, they avoid eye contact and seem apathetic. They do not express emotion even when discussing emotional subjects. Their speech is sometimes slowed, they may say less than most people, or they may use a monotonous tone of voice. Their speech may be characterized by long pauses before answering, failure to respond to a question, or an inability to complete saying something after they start it. There is often a similar reduction in their behavior. Patients' movements may be slowed and their overall amount of movement reduced. They may engage in little initiation of behavior and have no interest in social participation. These negative symptoms, though less dramatic than delusions and hallucinations and other positive symptoms, can be equally serious and result in patients becoming withdrawn and isolated. Negative symptoms are more common in men than in women. And to consider, the etiology of schizophrenia is not well understood. Early theories attributed to the development of this disorder to the patient's mother, who may have simultaneously accepted and rejected the individual during childhood. Research has revealed, however, that the causes of the disorder are much more complex. Schizophrenia does tend to run in families, and genetics clearly plays a role in the development of the disorder. For instance, if one twin develops schizophrenia, the likelihood of the other twins developing it is almost 50% if the twins are identical, but only 14% if the twins are fraternal. If one parent has schizophrenia, the risk of a child's developing the disorder is 13%. And if both parents have schizophrenia, the risk jumps to almost 50%. However, a person inherits a genetic predisposition for schizophrenia, not the disorder itself. Other factors must activate that predisposition for the person to develop schizophrenia. If genetics alone caused schizophrenia, the likelihood of both identical twins having the disorder would approach 100%. Schizophrenia is primarily a brain disorder. As seen in brain imaging, the ventricles are enlarged in people with schizophrenia. In other words, there's actually less brain tissue, especially in the frontal lobes and medial temporal lobes. Some researchers have speculated, however, that schizophrenia is more likely a problem of connection between brain regions than the result of diminished or changed functions of any particular brain region. One possibility is that schizophrenia results from abnormality in neurotransmitters. Since the 1950s, scientists have believed that dopamine may play an important role. Drugs that block dopamine activity decrease symptoms of schizophrenia, whereas drugs that increase dopamine activity increase symptoms. Other neurotransmitters may also be involved. If schizophrenia is a brain disorder, when do these brain abnormalities emerge? Schizophrenia is most often diagnosed when people are in their 20s or 30s, but it is hard to assess whether brain impairments occur earlier. There is evidence that some neurological signs of schizophrenia can be observed long before the disorder is diagnosed. Elaine Walker and colleagues have analyzed home movies taken by parents whose children later developed schizophrenia. Compared with their siblings, those who developed the disorder displayed unusual social behaviors, more severe negative emotions, and motor disturbances. All of these differences often went unnoticed during the children's early years. Such studies suggest that schizophrenia develops over the life course, but that obvious symptoms often emerge by late adolescence. Hints of future problems, however, may be evident even in young children. Because genetics do not account fully for the onset and severity of schizophrenia, other factors must also be at work. In those genetically at risk for schizophrenia, environmental stress seems to contribute to its development. This finding is consistent with the diathesis stress model, which was discussed in the previous screencast. One study looked at adopted children whose biological mothers were diagnosed with schizophrenia. If the adoptive families were severely disturbed, 11% of the children developed schizophrenia and 41% had severe psychological disorders. If the adopted families were psychologically healthy, none of the children developed psychosis. More generally, growing up in a dysfunctional family may increase the risk of developing schizophrenia for those who are genetically at risk. And by contrast, without a genetic risk, a child has a low risk for developing schizophrenia, regardless of whether the family environment is dysfunctional or healthy. Some researchers have also theorized that the increased stress of urban environments can trigger the onset of the disorder. In fact, being born or raised in an urban area approximately doubles the risk of developing schizophrenia later in life. Others have speculated that some kind of virus causes schizophrenia. If so, the close quarters of a big city increases the likelihood of the virus spreading. In support of the virus hypothesis, there is now strong evidence that maternal inflammation, such as occurs from a virus, plays a significant role in schizophrenia. And ultimately, according to the evidence, multiple factors may serve as triggers for the development of schizophrenia for those who are genetically susceptible.